Okay, how you doing? Sorry a bit late, everybody, but welcome to STA Sports Therapy Association. Let's talk about dun, 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 dun. Gary can't come tonight. Okay, I've just found that out. That's why I'm sweating a little bit. You see that? Gary can't come, but that's okay because we're still going to give you loads of information because we've still got a Becky in the house who's going to sort it all out. We don't need Gary and Becky. Right, so welcome. Thank you very much for joining us again. Episode 4 already of the Sports Therapy Association. Let's talk about. I've got my crib sheet here because I've had a very long day. I'm very tired. I'm not going to lie. I can't wait to sit back and just let Becky take over. But today, yes, last week we had Matt Scarsbrook of Therapy Evolved in Bristol Physio, and we were talking about online consultations, and the feedback as always was great. Apparently there was loads of really useful information in that, and some people have indeed taken steps to start online consultation. So that's wonderful. That's music to our ears. It's exactly the sort of thing we want to hear. So I appreciate everybody who did Facebook us, message us and email us. Keep that coming. If you've got any other questions with regards to anything you hear tonight or any concerns, then myself and Gary and the speaker are well happy to take your emails. Keep that coming. It's good news. So now with this week, we're actually moving kind of down the line now from online consultation, and we're going to talk about returning to work, which is obviously a very hot topic, but hot in the sense that it's a bit like a kind of that client you don't know what's going on and you chuck them to the physio and then they get chucked to a podiatrist and then an osteo, and it's kind of like that sort of client because no one kind of knows what to do and should we and shouldn't we and how do we and how much is it going to cost. So fortunately we're going to have all the answers tonight from Becky DeMott Horton, who knows the answers to everything. She tells me and assures me. No, she's probably not, but she is have got a wealth of experience as a soft tissue therapist and personal trainer with her own company Optimize near Newquay in Cornwall, I believe. And so she's going to be coming up and answering questions and sharing her knowledge. She also works very closely with the ISRM. So she knows about the kind of guidelines as involved in the organizations getting together and setting the guidelines for soft tissue therapy and returning to work during COVID-19. So there we go. Just before I bring Becky up, I'm just going to make sure I haven't. Gary was going to be doing security. So I'm just going to remind you now that there might be some debate tonight about, well, I'm going to go back to work. You can't tell me I'm not going to go back to work and that sort of thing. This is part of why we're doing this, because it does get quite hot. People's livelihoods we're going to be talking about here. And where money's involved, then violence often follows. So keep it cool, people. There might be people shattering your dreams and pissing on your parade, but this is what it's all about now. It's going to be communicating and hopefully letting you know maybe what the law says, but it'll all be positive because together we will all make a far more comfortable return to work than one by one and getting things wrong and all sorts of things going off. So if the debate does get a little bit heated, then I will chip in here. And I'm taller than Gary anyway, so who needs Gary? So there we go. So yeah, but do keep it friendly. Share, discuss critically, but let's not get too personal and kind of get too angry at maybe what we hear. Do stick around as well, because at the end of the show I will be giving a special Let's Talk About promo. The early birds for my Run Chat Live running conference, they're running out on June the 21st. So I'm going to give a code at the end of the show, which will give you a further 10% off the already discounted early bird tickets. So stick around for that. And also I'll let you know who's coming up next week, and so on and so on. But that's your introduction. If you do want to leave comments, then please do so. You can type in the box. I will bring your comments up here. If you don't see your face appear, it's because you haven't clicked that little link, which I've mentioned a couple of times. There is a link, faq.believe.tv/comments issue. It's kind of linked early on in the posts. You do need that if you want your name and photo to appear. That'll be why. Otherwise, you're just going to appear as a Facebook user. But anyway, right. That's it. I'm going to bring up the one, the only, Becky DeMott Horton. Let's get rid of that. There she goes. I'm going to bring her up by herself, just there by herself. There you go.
You've given me a big bill in here. I'm not sure I'm going to fulfil expectations.
I'm just gonna. Like I said, I've had a really hard day, so I'm just gonna sit back here with my cheese and pickle sandwich and let you talk for a
You
while.
just relax.
Is that okay? No, I won't do that.
Yeah.
Obviously. Thank you, Becky, for coming up. I must
Pleasure.
apologise again because I did leave you. I had a bit of a rattled preparation for this. I did log in very late, about 8 minutes ago, and I just saw us sitting there going, "Where is he?" So I apologise for that. I'm sorry, but thank you so much for joining us anyway. Before we get into the topic, let people who don't know you, I think quite a few people do know you because you've got a good reputation and everything. And like I say, you're involved with Anna and Matt, and you're already a member of STA, and you're also with Sports Injury Fix. So you get around, don't you? I think that's fair to say.
Yeah.
So and you were at the One Chat Live conference last year as well,
I was.
praising my mum's cakes, which is lovely. So yeah, you're one of the family. But yeah, let everyone who doesn't know you know, your experience and So.
Cool. Hi everyone. So yeah, I'm a soft tissue therapist. I'm based down here in Newquay in Cornwall. I run my clinic, just a one-man band. It's just myself. I work, actually, my room is in a running shop, a local independent running shop. So that's where I'm based and I work out of most of the time. And then recently I've got back involved with Anna Maria and Matthew, who I think everyone's come across more or less now from the school in Exmouth. And with them, we've got involved in the ISRM, and we've been quite heavily involved during COVID in terms of working on our online platforms with our therapists, trying to give them some support, some guidance, some help, a bit of an outlet when they need it. And I think that's how sort of you got in touch with me, Matt, was just some of the stuff we'd mentioned on those forums about how difficult it is at the moment, how stressful it is for everyone, and just ways we can kind of keep on top of that a little bit. So that's me, and that's what I've been up to for the last few months.
And talking about the last few months, has it been an anxious time for you at all and your business?
Yeah, definitely. So I actually started in that location about a year ago now. So still relatively early days for me in terms of working from that place. And it was sort of one of those really frustrating situations where the last sort of 4 or 5 months I was starting to go, blimey, this is working, this is going really well. And it was like a bomb dropped. So yeah, it's been hugely anxious. Initially, it was that kind of, oh my goodness, what's going on, and everything shut down. And I think me personally, I reached a kind of, I settled down with it when everything was shut down. And then the last few weeks, I think has been the most stressful. And that's what I've heard from a lot of other people, is that because businesses are starting to go back to normal, and we're wondering where we sit with that. And we're starting to look at different therapists being treated slightly different ways, and that's caused a real anxiety in terms of, suddenly things are moving and we don't know where we're going to come into that. So yeah, definitely it's been anxious for me. Financially, it's been quite difficult, and it's not fun not being able to work, really.
I noticed, and I kind of smiled because I know exactly what you mean. I think it's probably it's true for a lot of people, but where you said in an email that obviously the finance is affecting you, but also just the desire to see your clients and look after them again.
Yeah.
So I think for a lot of us, we're in this industry, not because we're planning on making a lot of money. For that, we would have done something else, or it's because we enjoy helping people. That's without patting ourselves on the back. It's just our character. So that's quite an anxiety in itself, isn't it? Feeling you're letting people down. And have you had anybody out of interest asking you for massage or treatment or anything? Or
yeah, I mean, I've done quite well at managing to stay in touch with my clients. So most my existing clients, we've had a fairly open dialogue throughout this, so they've known what my situation is. I've been able to keep them updated in terms of if and when I'll be opening. I've had a few new messages from people I don't know, that I don't know if they have been living in a cave, or or were chancing their arm, or it was just genuine naivety. But a couple of times I was a bit like, okay. I've picked up some new clients that we've had chats online with. We've done some online ones, but yeah, I have been approached. And I think the last week or so, more than anything, I've had a lot of contact from more regular clients saying, when are we going to be back? Can we plan something? They're starting to see everything go back to normal. So it's slightly confusing for them as well. So it's been a lot of clarifying over the last week or so.
Yeah, it's an interesting one, isn't it? Because I know I've had a couple of people saying, "Oh, it's." I think it's made me even more kind of against opening up too soon, because I have had a couple of people reaching out and going, "Oh, at least we can do a little gait analysis, isn't it? I mean, you're on the treadmill, you can stand the other side. I just really want to get rid of this." And I've managed to turn it around again without blowing my own trumpet. Like you say, you can turn it around and find a new client. Some people don't understand how important it is, clients and therapists. But it's a bit, I mean, only the other day, hairdressers are famous for this, I think. There's one thing that's really seriously affected people during COVID-19 more than anything, it's not being able to cut your own hair. So some hairdressers have actually been given their services. And I personally know someone through a friend of a friend and family and stuff who was cutting hair.
Yeah.
And it's just turned out that her sister has COVID-19. And she is now in for tests, and she's been seeing people and that, and now it's just this pyramid. And I've
heard, I don't want to, I'm not hairdresser bashing, but I think it's the
it's
one we're all aware of, isn't it?
It's money, isn't it? Yeah.
And that's the thing. And, I've heard people getting messages along the lines of, "I'm desperate, I'll pay you extra," lots of, not just therapists, but hairdressers and things like that. And if you've not earned any money for 4 months, it's a massive temptation. And on the flip side, I've heard some, my friend's elderly mother has sort of said to her, "Oh, the hairdresser said she just nipped round and she was only going to see me." And you think, yeah, how many people has she said that to? And it's a bit of a dodgy one, isn't it? It's, for me, it's quite clear cut. That's why, obviously I'm going to blow the trumpet, the ISRM and the STA, but that's where I felt quite secure with them, in that for me, it's just black and white. I can't go back to work. A, I've not been told by the government I can, and B, I'm not insured. So it's just, and anybody that does contact me, "Oh, could you just, maybe you could see me as a friend or something like that." No, it's just black and white at the moment, which I've found that for me, that's made it easier to respond to those kind of inquiries, because I've got no grey area at the minute.
Yeah. I've got to say at this point, and I'm reminding myself today to make sure I mention it, that personally, me, in case anyone looks me up and sees what I do for money and stuff, I lecture on the side. So my income is safe. And actually, I'm doing more online consultation now and seeing more clients than I did face to face. So for me, I haven't had that pressure of, I haven't got any money. I don't earn much money, but I've still got enough to look after my kids and everything. So straight away, if there's anyone out there who is thinking, well, it's okay for him, or, they don't need the money, but I'm really stressed out, I need the money, then feel free to speak up, because we are aware of that. And one of the biggest causes of stress is, where's my business going? I've already seen businesses collapse because they just haven't been able to manage it. Maybe they haven't had the support or the help or anything, but they've already, a couple at least I know, have closed up, gone, finished selling the business. So if you are one of these people in the room tonight who is really struggling money wise, then do speak up. And then maybe myself or Becky will have some ways to support you, or someone else in the room as well. That's
and I think that's a really important point to make. Like you said, I think sometimes, especially in this country, because we're so ingrained with the NHS, anybody that's in a kind of caring profession, we're almost nervous to talk about money. And all of us want to emphasize that we're in this because we care about our clients. We want to get back to work to see our clients, and that's all true. That can all still be true, but we can still talk about the fact that we need to pay the mortgage, and we need to pay the bills, and you need to put food on your table. And it's okay to sort of say, actually, I need to get back to work because I need the money as well. That doesn't make you any less of a caring therapist. It's just realistic. So I think that it's sometimes I think therapists almost need to be given the permission to talk about money.
Yeah, no, it's true. It's it's so scary for some people. My heart goes out to anyone who is suffering. Let's get rid of the elephant in the room at the moment. And again, if anyone else there wants to say anything different and they're thinking of opening up next week, or they've got a date when they are opening up, what is legally, I mean, you mentioned you haven't got insurance. What is the guideline at the moment? Is it a case of similar to the hairdressers, where as long as Boris says it's okay, it's like July the 5th or something? Or what is the deal with soft tissue therapists?
Yeah, so I'm not going to claim to be an expert, so please don't string me up. Obviously, I've been involved with talking to the ISRM about the guidelines. So my understanding and our understanding widely is we're sitting in that personal care category in terms of soft tissue therapists. I believe sports therapists are in the same category, although I'm not an expert on that at all. And we will be given permission to go back to work when that kind of bracket of professions, hairdressers, beauticians, that type of thing goes back to work, which I believe the date we're working towards is the 4th of July. Now, whether that will be the 4th of July for an announcement for a later date, or whether it will be, 4th of July, crack on, open your doors, I don't think anybody knows yet. There's been some speculation in the media that we will be an even further delay, but even as far as I'm concerned, that has just been media speculation. I don't think I've seen anything from the government or any of the professional organisations that supports that at the moment. So I think it's very uncertain. I think the 4th of July is probably a sensible date to be working to, and everything I've seen in terms of government announcements seems to be progressing the way they expected it to. So there's nothing at the moment to suggest that's been derailed from what I've seen. So I think it's sensible to work with that date in mind, but you need to realise that date is in pencil, very much in pencil. And that's the conversation I've started to have with my clients is, look, I'm happy to take bookings for you for that week after I'm sort of saying for me from the 6th of July, I'll put bookings in for you, but you have to realise that these are provisional and it's completely dependent on what happens. And if we get pushed back a couple of weeks, it's fine, we'll reschedule you. But if you feel comfortable knowing that there's something booked in for you, then that's great.
So that's interesting. So you're actually taking bookings. You've already got something on the tables, have you, for 6th of July onwards?
Yeah, so that was a funny one. To be honest, I feel it'd be interesting to know other people's experience with this. I feel like I've almost been nudged into that a bit sooner than I wanted to, because a lot of other businesses locally were starting to announce that they would be hoping to return to work from them. So I kind of didn't want to appear that I was ignoring it. So yeah, I've sort of said to people they can book in if they want to, but it's almost, to be honest, they're booking in and they are booking time slots, but it's a kind of an expression of interest rather than a hard and fast, you've booked a date and a time.
It's an interesting one. I'm glad you said that. And I've put it up on the screen just in case anyone's not quite sure. But yeah, like Becky said, I'd love to know if anyone else there has also started taking bookings for July, if that's helped with your stress. Personally, I feel a little bit of baby sick in my throat when I think about going back in July. I just think it's too effing soon, but it just makes me a bit anxious thinking about it. And it's probably something I've got to get over myself. But as a lecturer, and I was talking to Anna about this today, I'm actually being encouraged to go back into college and teach massage therapy again, level 3s and level 4s and stuff. And that's kind of making me feel a little bit again. But I can see let us know if anyone else out there has actually started taking bookings, because it's true. I mean, if Boris does turn around, and I've got to stop calling him Boris because it just sounds too friendly. It's how he's got to where he is. If Johnson actually turns around and says, "Oh yes, on Wednesday you can actually all go back," then in theory, yeah, legally you can. I guess insurance companies will, as long as the government said it, insurance will then kick in and everyone will be covered.
Yeah, I mean that's our understanding, is that as long as we're working within the guidelines given by the government and then the guidelines that our professional associations have issued, then yeah, it is. I think it's going to be. Yeah, I think it's sort of, like I say, taking those bookings for that first week is maybe jumping the gun. And like I say, I think I made that as a bit of a rash decision that, maybe needs to be thought about again over the next couple of weeks. But like I say, it was more of a way of saying, there's maybe light at the end of the tunnel. But I understand what you're saying about feeling really nervous about being back in clinic in 3 weeks. It's having spent the last 4 months not being allowed to go near anybody, and having to stand 2 meters away from your mum. The thought of being in a room with someone and having a hands-on treatment with them is quite daunting.
Yeah. And also, I'm inherently and genetically non-trusting of the government, and I just think everyone's just doing it because of financial reasons and trying to save the economy, and that's just me as well. I don't trust many people, but that's something I've got to deal with. Let's have a look if we've got some comments or questions from here, particularly about taking appointments, because I can imagine that helping some people. It could help your business because you're engaging with your clients again, and if it turns out that that booking can't happen, then you could, if you've got the strategy in place, then you could say, well, let's do a virtual. Let's take advantage of this time and actually do something online. Let's have a little look in here. Who we got in the house? This is a question that I want to bring up. It's came a little bit before, so I'm sorry about that. Is it Nicola from Caramel Health? It is, isn't it? Let me scroll back. Yeah, Nicola. Hi, Nicola. How you doing? Nicola has a question here. New client inquiries here too. Explain the situation and directing them to online registration. MH and COVID-19 declaration on my website. Offered online consultation. Minimal uptake. So, are you saying, Nicola, that you tried to offer them online consultation and they just weren't interested? Yeah, I suppose that's. What we were talking about last week with Matt Scarsbrook and that. Maybe it's how you're offering it, or maybe you just got to do that follow-up or explain a bit clearer what you are proposing. Any comments on how to encourage that, Becky?
Yeah, I think it's a tricky one with new clients, and I think it comes down to a lot of what the client expects as well. If they're seeing you as a massage therapist, I think that's going to be quite an alien. Well, why do I want to talk to you on an online call? Yeah, I think depending on what they're after, and I have had a couple who have been struggling with injury, and it is a bit of an education process that actually I don't need to see you, I don't need to be hands-on, but I think the person's got to be fairly open to it in the first place. And sometimes I think it's a lot easier with those existing clients that know you and know what you can offer them without, they probably already have that thought process going, don't they? Well, actually, sometimes when I go to see Becky, we just do some exercises or we just talk about things. So there's no reason why we can't do that online. So yeah, I think sometimes client expectation is tricky with that one.
Yeah. I think also it's a good time to, if you have got particularly new clients coming to you, I think it's an opportunity. I fear that people, particularly looking for massage, maybe aren't quite aware of if they are allowed to book appointments and come in, do they really understand the protocols that are going to be put into place and how they're going to come to your clinic? It's going to look shut to start off because there's going to be no one else around there. They're going to walk in and be by themselves with probably a cross on the floor and someone in a mask greeting them with Darth Vader voice. It's just going to be a bit weird. So I think there's an opportunity there for, especially now as it could happen, to, I think it was on the Sports Injury Fix podcast or something where there was an interesting point brought up from a bunch of physios talking where someone said, put a video out on your website or do a little video letting clients know what to expect. I thought that was a great idea.
Yeah, to be honest, that sort of occurred to me of almost like a walk through. This is what's going to happen when you get here. And I think that's, like you say, it's not going to be the experience that they're used to. Especially if you're someone who has, a nice relaxing environment. As a clinic, mine's a bit different. We kind of walk through a running shop to start with. So it's always, there's a bit of buzz going on there normally. But let them see what is going to happen and what it's going to look like. And then let them make that decision as to actually, does that impact their treatment so much that they'd rather chat to you online? Or are they happy to put up with that to come and see you? But I think we need to be really open and just communicate with everybody. And I think from my point of view, if I was booking a treatment, I'd like someone to explain to me what was going to happen and know what to expect when I got there. And I think that's only fair, really.
Yeah. There's a whole load of protocols like that, which I think people, rather than sitting at home, understandably getting stressed out, could be putting that mental strain to something more productive and getting protocols ready, things like that. It's going to be very important because not everyone's going to want face-to-face with the protocol that you're going to need when you open up. Some of them are just going to take a run and walk out, or they're going to be stressed out. In theory, they should know exactly what's going to happen. They would have done a pre-questionnaire. They would have actually had a conversation discussing whether they actually need to come in or whether it could be sorted out virtually. So it's a good question, Nicola of Chamomile Health. I would look at your website and maybe put something there which people can watch without having to talk to you, which is up there 24/7.
Yeah.
That's a good idea, isn't it? Where you're informing people without actually having to have that phone call or discussion email. Let's have a look down here. Lots of love for Becky in the room. Anna Maria's bigging you up. Lots of people saying they got no money. So if you are out there skinned, don't worry. There's people who are in the same boat. Not me. And I hasten to add, because I hate people thinking that I'm taking that for granted. Let's have a little look here. Yeah, so Claire Hunter brings kind of just fuels my anxiety about 2 metre rules still being discussed by the government to reduce to 1 metre. Not sure how in a few weeks hands-on can be safe from the 4th yet. And that's how I feel that little emoticon with the zip. It's like it's very true.
Yeah, it is true. So again, I'm not an expert, but we've had a health and safety guy working with the ISRM to sort of draw up our guidelines, and his position of it is obviously each step of this relaxing of the rules is dependent on the R rate coming down. And if the R rate comes, my understanding of what he said is that if the R rate comes down to what it would have to come down to for us to open up, the assumption is that the virus isn't as widespread in the community. So that 2 metre rule in certain situations with certain precautions in place, like face coverings, it is less vital. But yeah, it does seem very kind of, it's a massive jump, isn't it? I've not been within 2 metres of anyone other than my husband for 4 months, and now you want me to go into work and see however many clients in a day. It does feel like a big jump, definitely.
I think sometimes, and I'm saying this as if I'm not anxious, so I'm being a total hypocrite, but when I was listening to people who have been already gone back to work, so physios, for example, who have actually been doing it already for a while, and they've kind of said, first of all, it felt really weird, but actually their feedback was that, one, the clients actually enjoyed it. They liked the idea that you're taking precautions to look after them.
Yeah.
And two, I mean, although it feels like something new and different, you're screening the whole time when someone walks in. There's always that kind of clinical thing going on. So yes, you've got a mask on. Yes, the client's going to have a mask on, and there's hand gels and all this sort of stuff that's going to be necessary. But most of the feedback I've heard from physios who have already been doing this is it's like everything. Within a few sessions, it just feels like, well, this is the new norm, both
Absolutely.
for the therapist and the patient or client. So.
And it's interesting, having chatted this week to friends of mine that work in retail that have went back yesterday into retail environments, and like they were saying, actually, in a way, we can be far more controlled than they can in a shop. You know who your client is. You can screen them beforehand. You can take those. The fact is, you're with them for a long time and you're in close contact. But in terms of who we see and how we can control that situation, we've got a good opportunity there to control it, and it will become more. Let's face it. 4 months ago, we didn't have to stand outside Morrison's queuing to get in the door, did we? And that's become very normal. And these things will become normal.
Yeah, it's true. That's a positive thing. Let's just end the show there. I feel positive. Thank you very much. Good night. Any other questions? Let's have a look. We got the Sports Rehab Clinic commenting on the fact that 4th of July provisional for our private health clubs are open. Football, the players are back in pods of 4 to 6 players. However, I can't treat them. Yeah, it's weird, isn't it? I don't follow football, but it does strike me. I don't understand how it's going to happen. Have games started yet? Are the players not allowed to hug? Are you into football, Becky?
I did, by proxy. I have to watch a lot of football in this house. Yeah. So I can tell you, in German football, they're hugging.
Are they? The
Germans are hugging. I think professional sport's going to be treated very differently to amateur sport. And I met up with some guys bumped into. I finished a run. A couple of girls were coming out to do some rugby training, and I think they're back in, again, they can train in groups of 4, but they can't have any contact. Yet, like she said, they're passing the same ball between them. So it's just very strange, isn't it? And I think things like health clubs and sports centres, gyms, there doesn't seem to be much talk around how they're going to operate either. And I know a lot of them are working to this 4th of July date as well, but with even less kind of guidance than we've had, really.
Yeah, it's hopefully it will become clear once our beloved Prime Minister takes to the stage and explains exactly what we need to do. Every time I see that advert on TV, my wife always has a go at me. She says, just calm down, stop being a grumpy old man. But it's like, and when you go outside, maintain that 2 meters where possible. Well, what does that mean? It's just maintain 2 meters. Well, if you can't, if there's a lot of you, the adverts just drive me. They don't say anything. It really winds me up. I need a chill pill. Anyway, I don't know who this person is because maybe you haven't clicked the link. I don't know, but I'm going to bring your comment up. It's Facebook user. And they say, I've been taking bookings from 6th of July. Like Becky, it is very much in pencil and under the proviso that things may change. I'm only booking people in that contact me that seem to be in need. Well, that's a good point. Yeah. You definitely need to have that consultation just to make sure that the person really needs to come in with a bit of education on there. I'm not advertising that I'm taking bookings. Okay.
No.
Yes, that's cool. Who is that? Type your name again, whoever that is. I'd like to know who you are. Yes, that makes sense. I like this idea of people taking bookings, and then because in my mind I'm thinking that could be converted as long as you've got the system software in place to a virtual.
That's it. It's almost a way of opening a dialogue with your clients and a bit of a, it means that I've checked in with some people that I hadn't checked in for a month or so, and it means that we're kind of talking about it, and they've contacted me telling me why they want an appointment. So if it's something that I can help with now on an online thing, we can approach that. If it's just me knowing that they want an appointment at some point when I can open, then I've kind of, like I say, it's more for me making a list of people that might be interested.
Very sensible. That's good. And also, probably all of us have had those appointments where someone's come in with an obviously acute injury, which happened last night on the dance floor with a stiletto incident or something. And you can't really treat them now. You can, if they want to, you can rub their back and shoulders and stuff, but you can't go into this ankle that's killing them or the lower back, which is killing them. So even in those situations, you're going to do what in theory you could do with a virtual consultation. Is take them through the whole RICE protocol, calm them down, do a few tests just to make sure that they haven't done something serious. You could do your red flag tests, look at the case history, the subjective, and that's what those people want. And we all know it. We see it when someone comes in a spasm and they can't move. And by the time we've done a little stiff leg raise test and said, you know what, there's nothing really serious going on here, and you've looked at the case history and there's no nighttime pains or numbness or weird stuff, their pain goes down, isn't it? You can see their face. So
absolutely.
There's so much you can do with acute people online.
Coming back to that booking things again, it just means that clients feel they can talk to you. So if someone contacts me now and says, can I book an appointment for the 20th of July? And, I'm going to contact them and say, well, look, that's quite a way away. What is it that's the issue? And can we do something now? Or do I need to be referring you now to someone that could see you?
Yeah. Yeah, it's a good point. I'm going to bring this comment up because it's true and it's deserved. It says, Matt, yes, that's me. You said, this is talking to Scars, but you said you would feel sick if Boris said go back in July, but as you've said, you're financially okay. I wonder if you feel different if you're on the breadline. Yeah, I know. Probably. Yeah, I imagine so. Yeah, I imagine so. But again, I'm hoping that with these talks, I think there's probably avenues that therapists haven't exhausted yet to get away from that horrible I'm on the breadline thing here. Unless you have tried online consultations and you've got support and you've reached out, then I think there's possibilities there of having that income ticking over. Definitely now where it looks like we can go back, there's lots and lots which people, massage therapists, can be putting in place so that when the doors do open, you're done, you're prepared. I think there's going to be an awful lot of therapists who are surprised and losing clients because they're not prepared when they open up, or even being shut down. Imagine it's going to be kind of like backstreet takeaways or something where they're trying to save some pennies. And there must be, there's going to be, there's an awful lot of protocol that needs to be put into place with regards to reception, taking money, all sorts of things.
Yeah. And I think that's, one of the points I made in our ISRM forum the other day is spending your time now trolling the internet, trying to work out when we're going to be allowed back, exactly what protocols are going to be in place when we do, is probably not the best use of our time. The things that we can do are all your client notes up to date? Are you happy with your note-taking system? All those kind of admin-y jobs that we don't get often, chance to do. Are you happy with your consultation forms? All those things. Use this time now to we've maybe got a light at the end of the tunnel that we're working towards, and you've got a date to work towards. So you've got 3, 4, however many weeks to get that stuff tidied and sorted up. use it to do that. But I think whoever Facebook user is, that's a really good point. And that's the issue that I was saying earlier as well, that we can't be scared to have that conversation about finances. And it's okay to feel that, purely financially, I'm desperate to get back to work. I haven't had any government support because of how old my business is. And it's tough. It's really hard. And if it was purely financial, I'd be banging my drum, let me in, but I want to feel that everything's safe as well. So I think it does change your opinion.
No, it's
definitely.
Got to. Yeah, I'm sure it would. I'm just hoping that whoever that is, that you are getting the support you need. I wish I did know your name. Type your name to see.
And always reach out.
Reach
in
out,
these forums. Gary's great at telling you what help's available in the ISRM. Anna's really good at it. So there are people out there that can help you. If just make sure you've tried everything there is out there.
Yeah, definitely. Let's have a look. This is another Facebook user message, so I want to bring it up. I'll read it out. I've had a lot of clients message over the last few weeks wanting treatments. It's a difficult situation as you want to help, but also like everyone else for financial reasons. I have been self-employed just less than a year, so don't get the furlough. Is this you, Becky, just typing on the side?
Yeah.
I'm not eligible for universal credit.
Like
Paying the bills was getting difficult, but at the same time, I couldn't live with myself if I was responsible for passing on to a client or my family. And that just adds the stress, doesn't it? That's got to be double trouble. You imagine you're not getting the money and you're worried, just seeing yourself not getting those bills paid. And then you're feeling this, I don't want to go back to work because I could cause someone serious injury or death. It's very hard.
It's hugely conflicting. And the only thing I'd say to that is someone made a good point a little while. I can't remember if it was Mike James or someone else. Think about the longevity of your business. It might be really tempting now to go back before we're told we can. But if that ruins your reputation as a therapist, then you've got no business going forward. And also, I think there's ways of communicating with your clients as to why you're not going back just yet that will mean they stay loyal. You're not going back because although you'd love to, it's not safe for them, it's not safe for you, it's not safe for the wider community. Have those conversations and they'll stay loyal to you, and you'll be busy whenever you can reopen because you've shown that you are a caring therapist.
Is there, I know the answer to this, but I just want to make sure that anyone listening who's not sure, is there clear guidelines? Is there kind of a checklist that therapists can now tick off with regards to, is my business going to be ready to open if it can on the 6th or 7th of July? Where would they go to tick those boxes?
I don't know. You'll have to tell it. That's a trick
I was kind of thinking the ISRM guidelines are pretty good.
So we've brought out guidelines in the ISRM. We've been very clear that they're preliminary. And so we brought something out because people were asking, and we were worried that people were going to start panic buying things based on what physios and osteos needed. So the kind of full PPE that they were using. And we wanted to reassure people that they don't suddenly need to spend hundreds of pounds on aprons, visors, things like that. So we brought something out, but we are very aware that they might change. So at the moment, it's kind of a checklist, but it's a movable checklist. We are also, and I think the STA are doing the same thing, we're bringing out a kind of a sort of COVID consultation form as well, if you like. So other than your normal initial consultation form, a COVID screening form, and any kind of contraindications that might come up from COVID as well. So people that are in vulnerable groups. So that's something that's coming up, hopefully, I think they're working on this week. So that will be another thing that then you can start to think about, how am I going to build that into my normal paperwork that I do with my clients? So yeah, you can use the guidelines that we've got, but again, just be aware that they might change.
Which is great advice, but it's at least people are thinking, well, and I think there might be some surprises. Like you say, some people are spending too much and worrying too much, but probably on the other side, some people are not worrying enough and realizing that there will be expenses, there will be costs. You will have to leave a longer gap between clients. You may well have to make clients, sessions longer because you're going to need to make sure you can fill out the notes at the end and stuff. There's quite a few things to think about for anyone who's not. But yeah, I think Gary was very quick to get the same list out when he's talked to other organizations like ASRM and that. So there is, I'm sure it's in our folders in the STO group as well. I'm sure Gary will mention that in a second. Anna, as always, has made me kind of feel a little bit more safer. Here we go. I love the way she puts things. So Anna says, if the roadmap to recovery is on track and the community rate of infection has lowered, it means that the risk has decreased. Let me just find where it is. The risk has decreased, and therefore it will be safe if precautions are taken as guided by relevant bodies. So there you go. That's nice to hear as well. But it is all dependent, isn't it, like you say, on that rate of infection.
And I think the point we were making in the ISRN the other day is that if everything like the roadmap goes as planned and we are allowed to reopen, the assumption has to be that as long as you're following those screening protocols, you're a healthy client, you're a healthy therapist treating a healthy client. So actually any precautions that are in place are just for that very chance that someone's asymptomatic. But I think Matt put another comment in earlier about, at the moment, 1 person in 1,000 has the virus. And, so it is, we've got to realize that if we are allowed to open, it's because the community rate is low enough to assume that when we do a screening, we're both healthy.
Mm-hmm. That's good. Okay. Someone else just said here, I'm on the bread line. I won't be going back until as late as possible. It's such a personal decision as well for people as well. We can't take that away. It's very much to do with where you live, if people are going to have to put costs up to cover the extra things you need to buy, then are your people in your area going to be able to afford that increase? And it's so personal.
It's hugely personal. I mean, like I say, I'm down in Cornwall, and actually, funnily enough, we've kind of been a little bit sort of isolated from it slightly. I don't think it's affected us the way big urban centres have. So I can feel quite comfortable because it's not been a big threat to me as such, but I can see why other people wouldn't feel like that. And I think whatever guidelines we put out, whether you go back to work or not, has got to be your decision, and because you feel comfortable to, not because you feel pressure from the wider industry or fear of losing your clients. You've got to go back when you feel comfortable to.
Mm-hmm. Yeah. I'm hoping that's something which STA will succeed. Well, I'm pretty sure they will. But just because there's obviously that fear that, well, if I don't go back, someone else will down the road and they'll get all my clients. Yeah. But what would you say to that person who's worried about losing clients to others?
It's really difficult. And I think that started to happen already when, physios and osteos could open up. There was that, all my clients are just going to go and see them. All I can say is I think communication is the most important thing, and have some trust in your clients as well. People generally are quite loyal, and even if they maybe do go to see somebody else for a treatment whilst you're still closed, there's nothing to say they're going to prefer that person. They'll probably come back to you because they were seeing you for a reason in the first place, and that's because they like you. They engage with the way you treat them. They believe in what you're doing to them. And yes, they might go and do something for an interim, but they will come back to you as long as you're open and honest with them and say, look, everybody else is opening up, or other people in the area of opening up. I've chosen not to, and here are my reasons why. And I think most people will be really understanding of that. And it's just it's hard. And I've been through those fears as well of, all my clients are going to go. They're just going to go to someone else. And it's easy to kind of think that, but then just rationalize it a little bit and have confidence in yourself as a therapist that they were with you for a reason in the first place.
That's very good. You're good, aren't you? She's good, isn't she? She's good. She's good. No, it's good. It's exactly the sort of things which I think a lot of people want to hear, hopefully, and people out there. Hope you're all feeling as warm inside as I am from hearing that. It's good. It's true.
You need someone else to tell you, because none of us will believe it of ourselves.
Oh God, yes. No, without a doubt. There's a Facebook user here. Apologies, I don't know your name or your photo, but I'll bring you up. Maybe you can clarify in a minute who you are. And let us know what your Facebook page is so we can have a look at it. But this person here has said, I put a sped up video and brief of what to expect from a video consultation, which really helped me. Off the back of that, where is it? Sorry. Off the back of that, I got an influx of people booking remote consultations. Recommendations on my Facebook business page also helped. Yeah, let us know what that business is. Let us go and have a look at your sped up video. I think that's a really good idea. It's great. There, you've got an advert there for 24/7 instead of waiting for people to email you an answer. So sped up video is great as well. I mean, they look excellent. Yeah, good thinking. Who are you? Let me know.
I think that's really nice as well. It shows that you're thinking about your client, and you're acknowledging that they're going to be nervous and that they're going to have concerns, and that you're addressing that and you're thinking about it.
Yeah, I want to see that video. Let us know who you are. That'd be good. Let's have a little scroll down. I'm not going to say that. Yeah, just talking about insurance, very important as well. People who maybe, if you are tempted, if things are really bad and you think someone's offered you money, please see me. I'm really worried about this, or my son needs to go to football coaching or something, whatever it is, you're probably not insured. There's probably a major loophole in. I mean, if you're insured with Balance, then it's pretty clear cut. You won't be insured because Balance work with us, etc., etc. But if you've found, when something seems too good to be true, it's probably because it's not. If you've managed to find someone who insures you to go back, and everyone else is saying no, and don't take that risk of doing it without insurance, because that'll just lead you down a whole pathway of hell, and then you really will be skinned forever. But it's difficult. Temptation. As Anna points out again, I can't see that anyone practicing now unless they are within the regulated professions are covered. Simple as that. It's a shame that we're not part of regulated professions, but the fact is we're not, for reasons which Gary always talks about. We're not allied professionals. Maybe one day we will be, but until then, we're not insured. You were going to say, sorry, I butted in. Becky.
No, I completely agree. We're not, there's been a lot. And one of the good things about this, I think that has sort of wakened our awareness of that we are classed differently. And maybe that's a conversation for after this. And I know it's brought a lot of organisations together to say, well, actually, we need to work for the greater good of people at our level in the MSK care industry. But we are where we are at the moment. And as far as I'm concerned, it is quite clear cut as to who can work and who can't at the minute.
There's an interesting question here. I think you mentioned it, but it says here, are people that are booking people in for July booking in essential patients only? I've noticed that people are expecting maintenance sports massage to be available, which in my opinion is crazy. So you mentioned, are you kind of scanning your patients and seeing whether they really need to come in to make that booking, or?
Yeah, to a degree. Some of them are. I tend to have a lot of clients who are manual workers, and they tend to come in for sort of that. It's not essential. I'll be honest. But it opens up that conversation. And we can then have a conversation, and what I've said to them all is, look, I'm provisionally booking you in, but I'm going to be giving you a call nearer the time to discuss whether this is the right decision to be making and what we've got in place. So for me, I'm kind of getting a brief, more as a screening, a red flag thing, because what I wouldn't want someone to do is book an appointment for the 5th of July and they've got a red flag. But I'm booking them in and saying, look, this is all up for review closer to the time. And I think that will maybe be based on what going back to work looks like for us, a conversation for then saying, look, this is what your treatment's going to look like. Is that what you want? And do you think that it's necessary at the minute?
Good advice. Great. Well, look, it's already 8:52. My idea originally was 30 minutes. Let's talk about, then it became 45. Let me just see if, Claire Hunter sums it up. That's Emma Hunter. Is there a Claire and an Emma Hunter in here? Oh, no. Emma Hunter, what did you have to say? I work from home in a spare room and will find it weird if I can open clinic but still can't have friends and family in the house. There's so many of these kind of like clashes of what's sensible and what's not, isn't there? It's
absolutely. True. Yeah, and that, I think people that work from home, that's another big decision to make. I'm not inviting people into my house, so I feel more comfortable with that. But that's a weird thing. Yeah, your mum can't come to your house, but your client could, and And
again, just definitely check with the insurance as well. I mean, that's the great thing about bail-ins, though. On the end of the phone, you really can get through to them. It's a family business. They pick up and it's like, oh, hello, and they'll talk to you. But definitely have that conversation.
Yeah, any insurance company that you're with, if and when we can go back, if you're not sure, speak to them, and then at least you know what you're doing, what you need to be doing.
Right. Serenity with, I'm going to put this up because it's a wonderfully long name. Serenity with Beck Sports Massage Therapist is asking, where can we find this checklist, please? Bex. Hey, Bex, how are you? It'll be in the, Gary will step in a sec, but it'll be in the STA folders, I'm sure. If not, if anyone knows, if anyone's in the house here who knows exactly where it is or how to get there, then please put that in the comments stream. It will be around. Somebody will tell you very shortly. Bex Serenity with Bex Sports Massage Therapist. But it's a good question. It is around. And if it's not, then we'll make sure it's indicated clearly. Right. I need to wrap it up. Oh, there we go. Seamus McWalter wants us to know that Seamus McWalter is watching in. There we are, Seamus. Thank you very much.
Hey, Seamus.
Hey, Seamus. Thank you very much. I'm glad you joined us. Right. And on that note, yeah, have a look through the comments, people. There's an awful lot of great stuff coming from Matt Scarsbrook and Anna hugely. Daniel Gerber's in the house as well. I'm not going to bring that up now because we're running out of time. Don't apologize if you can't get your name up, whoever that is. Oh, Becky Carroll. There we go. Rebecca Stone, sports therapist. Let's bring it up so people can see you. There we are, Becky Carroll. Maybe click that link. Hopefully, let me know if it doesn't work. I've been told it should work. Right, Becky. As always, yeah, we're running out of time. I'm hoping there is a lot of information there. Is there anything else that you would like, words of wisdom? You've already given so many, but for people who are not sure or anxious or stressed out?
I think it is stressful, and it's okay to acknowledge that. We're humans, we don't like uncertainty. It doesn't suit us at all. And there's no way around the fact that there's uncertainty at the minute. From my point of view, the way I've decided to cope with it is only listen to my very trusted sources and block kind of the rest of the noise out, and not spend my life trawling the internet to find bits of information, and just try and focus on those things that you can do. You know, get in touch with your clients, build your network, your referral network, talk to other people, do those things that you'll feel you're doing something positive, and trust yourself as a therapist. Your clients will still be there because they like you.
Brilliant. If people want to contact you, Becky, what's the best way?
I'm probably on Facebook the most, so Optimized Soft Tissue Therapy on Facebook is probably the best way to get hold of me.
Brilliant. Okay. And you're happy to help people
Always.
and all that?
Yeah,
always.
Absolutely. Yeah, definitely. Get in touch.
Well, thank you so much, Becky. That's
My pleasure.
Kind of you to give us your valuable time. I'll just send you back down to the lobby for a bit, but I'll come and say thank you officially in about 3 minutes. All right.
Thank you, everyone.
Thanks again,
good night,
Becky. Bye-bye.
Bye.
There we go. The wonderful Becky DeMott Horton. That was amazing. I'm hoping I felt there was loads of information in there for people. Right. We've gone over. Sorry about that, but it just seems like the content, I couldn't cut anything off. There's always, as always, many, many questions in there that people are talking about. So keep the thread going. Let this instigate more communication. Just because the show's over doesn't mean that the conversation has to stop. Before you do go, though, just a couple of bits of housekeeping to let you know about. Next Tuesday, we're going to follow this conversation more by putting some of the stuff we've talked about into practice. So Malcolm Sloan from Sports Injury Fix is going to be talking about some of the tools which you can put into place, some of the software, some of the ways of getting a digital consultation form, all those little things, client relationship management, all the things which you could be putting into place now, so that when our wonderful Prime Minister does go, yes, you can start in 2 days' time, you've actually got it all in place, okay? And you're not just going to start a minefield of stress even more that you're suffering now. So that'll be next Tuesday at 8 o'clock UK time with Malcolm Sloan from Sports Injury Fix. So do join us then. Next Friday, if you don't know already, is Therapy Live, which is CPD all day long. If you can get Friday off or just make Friday possible, then do please make sure that you tune in. There's so many streams, there's so many speakers, about 90 speakers. You still need to register. It is free, but if you go to the, just have a look at my posts in my timeline, sign up. There's about 17,000 people signed up. Me particularly, I will be talking at 2:30 p.m. in the exercise rehabilitation stream about how to put evidence back into running injury performance, getting across some of the hurdles of how to actually tell runners that stretching is probably not going to reduce their risk of injury, and overpronation is not actually going to decide what shoe they should have. What language do we need to use rather than just sounding like some pompous idiot who thinks they know it all, compared to the shop down the road who's got a flashy big treadmill and stuff. So if you are around on Friday, then 2:30 p.m. In the exercise rehabilitation stream is me. Last but not least, I did mention that there will be a code Run Chat Live conference 29th and 30th October, probably in Brighton if we can be face to face. If it's not in Brighton, then it will be 100% virtual, and any ticket bought for the face-to-face conference will be transferred to the virtual version, which will be equally as good with the same 10 speakers, the same question time with all 10 speakers on stream and everything. So if you go to rcl2020.eventbrite.co.uk, there's already early bird tickets on there, which are well discounted. But if you use the code Let's Talk 10, so LETSTALK 10, you will get a further 10% off the early bird ticket, which takes it down even cheaper. That will run out at 10 o'clock tonight. Bingo. You know you need to go now. rcl2020.eventbrite.co.uk. So if you're umming and ahhing, go read the lineup and use that code, and you'll get 10% off extra off the virtual tickets. Done. Right. 9:59. I'm in such trouble now. Anyway, thank you very much again for joining us. If you've got any further questions, like I say, contact Becky, contact me, contact Gary. Thanks for joining us, and thanks for talking to each other and communicating with each other. It's what it's all about. As always, together we will stand strong, and divided we will fall. Isn't that what they say? We'll be back next Tuesday with Malcolm Sloan Sports Injury Fix. My name's Matt Phillips, and this has been Let's Talk About with the Sports Therapy Association. Good night.